Thank you so much once again
Yes,
joining us, Sneha Chakraborty. And
yes,
it's a wonderful possibility for us to have you. And that's the very quest, that's the very fundamental philosophy of resource to, get hold of those experts from different domains and expertise and try to, sort of explore their perceptions in order to make something better in our society, in order to give something good contribution to our society, to make it as a open library so that people can have an access to those kind of narratives we try to cover during the interviews. This national podcast, thank you so much once again joining. You're working as nursing instructor at Tata Steel. It's a wonderful
yes, yes.
possibility for us. Thank you so much, ma'am, once again joining us. And I would like to move on to my first question, which is certainly a very important question. The topic is burnout of nurses, which is like, I would say, a topic which should be highlighted, a topic which should be discussed around across the nation so that we can have some better practices. This is the topic. The first question is, what are the main causes of nurse burnout in India?
In India, nurses burnout are due to mainly is that there are a lot of patient allocated, okay, to a single nurse. For example, in general ward, in one ward for one nurse, we have to take care for more than 15 to 16 patients. So about the patient care, so everything you have to do for a patient, like medical administration, you have to see the bedside, you have to arrange the bed for the patient, you have to do all the other basic care. So for a nurse, for like 15 to 16 patient, it is very difficult for a single nurse. So main cause, if we think, is that recruitment is little bit should be increased for the from the hospital side. So recruitment for the nurses are very low, and the shift is like 12 hours shift, 8 hours shift. They are not able to sit for a while. And for this, in this whole situation, sometimes like most of the nurses are dehydrated because they don't even have some time to drink water.
So thank you so much, Sneha Chakraborty, letting us know on this important issue. Like, what are the main causes nurses burn out in India? It's like important for us to know in order to sort of make the practices more appropriate, make the practices more compatible for medical staffs such as like nurses and medical doctors and other paramedical science practitioners. So now I would like to move on to my second question. Important question is this: how does burnout affect patient care and safety?
Like how burnout affects. So when a person is fully tired during his or her duty hours, why I'm telling his or her duty hours, in our profession, there are also male nurses and also female nurses, but most of the population of nurses mainly comprises 90% of female nurses. But the problem arises about the burnout when you are not healthy enough, when you are dehydrated, when you are not taking proper food at time, you are not taking proper sleep. How can you take care of other? That is the main problem. When a person is overloaded with work, like if a person is taking care of 15 to 16 student not sorry or patient per day, so how can the person take care of some critical patients? How can? Because he or she is himself or herself in a critical state. So this is the main cause. And what happens is that due to this reason, there may be medication error or lack of need practice. All this can be the main reason.
Thanks a lot for letting us know on this really important area, and it should be addressed from a medical perspective, from a public health perspective. Of course, much research
Yes.
is needed how to make it more better, how to hone it up, because it becomes very difficult because patient care and safety is very very important when they are hospitalized, when they are being medicated. And if a burnout, specifically addressing and speaking about nurses, it affects and impacts the very kind of quality of medication and care. That is certainly a matter of concern and should be addressed. And of course, I from a sociological perspective, we won't say that there must be some research, extra research, and kind of efforts to be conducted so that we can arrive at some right conclusions and possibilities and practices. So, would like to move on to my third question. Important questions is what signs indicate that a nurse is experiencing burnout?
Extremely burnout, your question, right? Extremely burnout.
Mhm.
Extremely burnout, you can see the person whenever we are overloaded with work. We cannot concentrate on a single work, and nursing is little bit multitasking thing. Okay, you cannot concentrate single time on one thing. For example, if you are having 5 patients, within that 2 to 3 patients are very much serious, and 2 patients are stable, but you are in charge of that 3 patients. So at the same time, you have to give proper care to different persons who are having who are having in a critical cases. So exactly what was your question? Can you repeat
It was
once?
like, what signs indicate that a nurse is
They are not
experiencing
able to
burnout?
concentrate in their work properly. They are feeling very much exhausted to carry on with their 8 hour shift. And if you have heard about, I think, about the overtime duties, especially whenever one or other staff is absent or taking a sudden leave, a nurse have to carry on with another shift. So total 16 hours of duty a nurse have to do at the same time.
Okay.
So that is the main reason.
Yeah, I mean, these are certainly categorical and important signs that we can understand that nurses are also experiencing burnout, and these are some of the reasons. And it does impact and affect the very possible output in terms of giving medications and looking after patients. And thank you so much for updating us and our audience on this important area and a matter of concern. Would like to move on to my fourth question, which is certainly a very important question. It says, how do nurses cope with stress and mental exhaustion?
Coping up is a skill for each and every professionals. So proper amount of sleep, proper amount of food, proper amount of water, proper amount of good peer support. Peer support means with the support of other nurses or other healthcare professionals. This can be the reason that how the burnout can little bit decrease. Another thing is that if there is a proper number of recruitment of nurses by the hospital, it can also reduce the workload. So reducing the workload is one of the key or the major factor to reduce the burnout of the nurses.
Yeah, thank you so much. It is certainly an important area, I would say, addressing, and my personal understanding that it may also differ department to department, because when it comes to ICU, intensive care unit, the workload may be different. When it comes to kind of oncology, the workload may be different, and gynecology and different departments, it may differ to some extent and to a deep extent. I don't know exactly, that you better understand, and your perceptions are highly appreciated, and I'm sure that our audience will certainly, once they sort of get once they listen to your perception and your narratives you've been sort of addressing, they'll certainly draw a major chunk of benefits. Now, would like to move on to my fifth question, which is certainly an important question, and at the same time, a wrap up question. It says, what changes are needed to reduce burnout among nurses?
You have to reduce the workload first of all, and by workload is directly proportional to again that recruitment of more nurses. Then reducing the hour. Then we should be provided with a proper restrooms so that within our hectic schedule we could at least rest for 5 to 10 minutes, which are lacking in some of the hospital. Even the nurses are not allowed to sit for a while during their duty hours. And allocation of the patient, there must be uh, according to the rule of INC or Indian Nursing Council, not more than 6 patients should be given to a nurse allocation should not be given. So if we follow the rule, but most of the hospital generally don't follow this rule, but if we follow this rule, burnout can be literally reduced.
Lot once again joining Reso platform for our national podcast, Sneha Chakraborty ma'am. And it's important that you briefed us up, not exactly briefed up, but you've given also deep narratives, nurses, their burnouts, and you've talked about main causes of burnouts here in Indian context. How does burnout affect like patients, patient care and safety? What are the signs indicating that they're experiencing burnout? How to nurse with the stress? How do they handle kind of compatibility with their mental exhaustion and changes needed to reduce their mental trauma and burnout? These are very important stuff that you've talked about. Once again, as you're already familiar, I've briefed you up in past also recently that Reso is a platform where we want to sort of develop a quantitative and qualitative body of data, library format like a video format, like record format, so that it's open to people who are interested and who have knowledge and kind of want to expand their knowledge in terms of different dimensions and domains, research and academic knowledge at the same time, practical knowledge. They can sort of have a look at and draw some benefits. So it's open for people. That's the reason you're on board with us. Thank you so much, ma'am, once again joining us. You're working Tata Steel Institute as clinical instructor. Thank you so much for giving your precious time, ma'am. We understand the very importance of nurses, that we've recently understood and have had the experience and should have gone through pandemic 19. We've understood how hard they work and sort of how tedious and strenuous it is for them, their duties and all. Sometimes they'll have to compromise their work stuff, their children, their family members, and sort of devote the time at giving medication at their hospital setups, and not just giving time but saving lives, as many lives as possible, because they are the core sort of members and kind of forefront warriors leading the medical profession. Thank you so much for that.